Hi there. Thank you for joining us to review patients on the move. These are your dental patients that are looking for somewhere else. Now, I like the fact that you've got this little kid moving these big packages, but one thing that stood out to me for this picture was that the little kid has a megaphone. When some dental patients leave your practice, they don't go quietly. They get their megaphone and they announce it to everybody they know. Now, that could be good reason, that could be bad reasons. I don't think any reason is a good reason to be announcing that they're leaving your practice. And so we want to talk today about how to basically look for these things that could make a difference to your patients on why they would want to stay at your practice. So instead of trying to get more patients in, how about keeping the patients that you have? So I want to look at some things today about that. Now, in that, just a little bit about me. I come from Perio. In that, what became a certified professional coder, certified outpatient coder, and certified professional biller, not for fun, but to make sure we were doing things correctly in medical billing for dentistry. And from there, I found that I have a passion for Perio in that we were seeing a lot of people come in for oral systemic cause, as well as some reasons that they were needing the treatment, not having the money, but having some insurance and causality that could help them get some benefits on the medical side. And so we started investigating that pretty heavily. And because I come from an office that's very heavy on continuing education for employees as well as other referring dentists, we were able to share that information with others on how we were able to get these benefits for the patients. And because of that, we want to build and share. DevDent is all about building and sharing what we do, educating, software, how to help your practice grow. Hopefully this will make sense.
Yes, I hope so. Tooth extraction. One tooth, but I need to ask you for a quote first. I need to know your lowest price. One tooth to be taken out, lowest price. Okay, well, just assume it's an easy one. Assume the cheapest one. Lowest price is the main thing. 1,600. Okay, does that include a nurse assisting you? How about if we leave out the nurse and just tag it in on the end of someone else's appointment? How much would it be then? 1,200. That's still a lot more than I thought it would be. Why so much? An hour of your time. Okay, well, I understand that because you gently remove the tooth, it takes a long time to, but price is the important thing here. Don't worry about gently removing the tooth or anything. How much for a quick 10-minute get it out extraction? 900, still too high. Does that include pre-injections, those little jabs you give that just numb up the gum before the main injection? Okay, what if you leave those out? Well, of course, yeah, I understand it will be much more painful, but low price is more important. What's your lowest price without the pre-injections? 700. Well, yeah, that's obviously better, but I may have mentioned low price is the most important factor here. So is there a way you can get a bit more off the price? Half dosage of the main injection, what will that bring you down to? Total agony, but 500. Well, okay, look, I really want the lowest price deal here. What if you do it with no injections at all? Yeah, I know it will be absolutely agonizingly, excruciatingly painful, but I really mean it when I say lowest cost is the priority here. Okay, I'll hold. Can't believe he's never done it before. Hello? Yes, I'm still here. 200. Okay, that's great. That's a deal. Right. Can I book the wife in then, please?
And I love this clip because that's kind of what we go through when we're dealing with patients over the phone. It's not about what it's going to do for your health or how it's going to feel better once we are able to get your treatment done. It all comes down to what's the lowest cost? What do I have to do to get it be the lowest cost? But here's what I want to turn around for you. Think about, why do your patients stay? Why did the patients that you've had for a really, really long time, why did they stay? So I want you to ask yourself, not the patient, but you, what keeps our patients at our practice? Why do they choose us? There are lots of other dentists out there. Why do they choose us? Ask yourself that question. What we want to go over within this webinar is looking at your front desk, the bait and switch. Now, that's a perception that your patients are feeling. It might not be an intention, but it's their perception. How about their second opinion? Oh, love those. How about hygiene hurts? I don't want to come. Hygiene hurts, or the high costs. And then there's always the aggressive sales. So let's get started with that front desk. How does your desk look? Number one, do they have training? My first day on the job, I was shown where to sit. I was given what to say over the phone when I answer it, shown how to answer it, how to put it on hold. I was also shown the computer, very scary, intimidating. And then I was told, good luck, I've got a lot to get done. Now, I was thrown into the mix, not because they wanted to see me fail, but it was truly out of necessity. We were so short-staffed, so busy, and it was kind of trial by error, working and learning as I went. So again, it wasn't that they were not training me because they wanted to see me fail. I didn't get trained because there was no time to train. It was literally, we need your help. And I knew that. I could feel that my team wanted to be there to help me. But how about look at your team in admin? Do they need training? There are so many places that can help train, either online, in office. I prefer in office, I'm not going to lie. You have Front Office Rocks, you have ADOM. I mean, ADOM has a plethora of data that could help your front office team learn. Have you created a manual of expectations for your admin team? Do they know what the doctor is looking for? Do they know the vision of the practice? That's important for training, because if they don't know the vision of the practice, or if they don't agree with the vision of the practice, what you're doing is for naught. It's not going to last. It's not going to work because their heart is not in it. So think about that. How about the verbiage? Words make a difference. If they say, it's just a cleaning, I can reschedule you. No, it's not just a cleaning. Elizabeth will be so sad that you weren't able to make it. Her next appointment is not for several months, and I know she was preparing for your appointment. Is there any way that you could possibly make that happen? I know that she really had some treatment that she wanted to help you with. Why is that important? Because it shows the specific person, the person that they're used to, using them by name. And they really are, our hygienists are really looking for the patients that they see on a regular basis. And I want to make sure that whoever's on the phone needing to move their appointment understands they're not going to get one with Elizabeth for months. And most of the time they'll come about and say, you know what, let me move something else, keep me on the schedule. So it's about the verbiage that you use when you're speaking to these patients. It's not just a cleaning. It's not just a post-op appointment. What if they have a lingering infection that could be getting rampant, that if the doctor had not checked on that post-op appointment, that patient would be in the ER? I mean, it is important. Every appointment that your doctor wants to see patients on is important, no matter how much you think it's a quick 5 minute. It is important for the doctor to see the progression of healing. Attitude. Attitude goes not just looking at somebody's face, it's also how you answer the phone. If you have a bad attitude, why did you do that? That was the dumbest thing I ever heard. Hello, Dr. Cohen and Gottlieb's office. It shows. So try to think of ways that you can change somebody's attitude before answering the phone. What that means for us is put a picture on your phone. So whenever you grab the phone, you smile. Because when you smile, it's hard to have that grumpy attitude come with you in your voice and your inflection. So look at things like that. Make sure your patients are greeted. I really tried to greet patients by name. Mrs. Smith, it's so good to have you at our practice. We've been waiting for you to arrive. Thank you so much for being on time and completing your paperwork. We really appreciate that. I'd like to show you around the office and the lobby. Our restroom is over here. If you'd like some coffee or water, that's located over here. If there's anything that I can get for you, please let me know. Why is that important? Well, if you just sit down and your head's down and then you look up, hi, what do you need? All right, I'll let them know you're here. Bye. Have a seat. I mean, it shows a lot about my attitude. I'm not even willing to stand up when you come in. I'm not willing to show you around if you're a new patient. I mean, that says a lot when you just arbitrarily write people off before you actually get to know them. I used to tell our team, find one thing that you truly like: purse, hair. I used to like hair color, their shoes, their outfit, the color of their outfit. There's always going to be something that you really like. Smile, even when you don't want to. Because when you smile, it's going to come out in how your voice reflects to your patients. So again, it's not pacifying. It's making sure they know you're genuine. We all have bad days. But if you can look at your grandkids or your kids' picture before you pick up the phone, it puts you in a better mood. So finding the things for the front desk that can help make what they do better. There should be no chit chat or whispering between staff members at the front desk. And a lot of people say, but we're behind this big plexiglass thing. Yep, but people see you whispering and they're waiting in your lobby. And guess who they think you're talking about? Them. So we cannot do that. That's not right. You might be so far on the spectrum of who you're talking about, but your patient doesn't know that. So the chit chat in the waiting room, or what they see from the waiting room, is very important. Make sure that they know, if they're waiting longer than 5 minutes, make sure they know, Mrs. Smith, I so much appreciate you waiting. Is there anything I can get for you? It'll be just a few more minutes. Acknowledge them. Now, have you sat in your lobby lately as a patient, looked out, smelled? Okay, it smells like chemicals. It smells like a dental office. Do you want that perception? If you want that perception, or if that's where you're going with that, that's absolutely fine. Our doctors did not want our office to smell, look, or be visual for a mental picture of the practice. They wanted it to be welcoming and inviting. We had a Asian theme for our office, so it had some Japanese lanterns and this big, beautiful picture. We had some scrolls, written scrolls. It doesn't take a lot of money to create a theme, but have a theme. Have something be, what you could get that's like-minded of the doctor's vision. So what we would do is we would look around and sometimes move pictures. Maybe the picture that was down the hallway, we now put in the lobby. And patients used to swear that that was a brand new piece of art, when all we did was change it around and shift it around, make it look different. And that's important for your patients to know that your doctors and your practice is up to date. Marshalls, TJ Maxx, Hobby Lobby, all of those places have great pieces of art that are not inexpensive. Do you make sure your patients that are waiting understand why? Maybe you had an emergency. Our practice co-branded with Starbucks, our logo, our address, our website, our phone number on a Starbucks card. So when we were running late, we would give our patients a Starbucks card, thank them for waiting, apologize for the delay, and every 10 minutes they would get another one. So they'd say, you're good, don't worry about it, not a problem. So they would collect their Starbucks cards, and they were sharp looking. They were not a cheap look of, here, we picked these up at Starbucks for patients who had to wait so that they wouldn't be mad at us. No, it branded our practice. So when they took that Starbucks card, they would be reminded of us. It had our logo, it had our phone number, it had our website on it. So think about that. Once you get that print made with Starbucks, it's a one-time layout fee. And every time you reorder, it's just the cost of the cards that you purchase. What are you doing to help your team gather health information to make the clinic job easier? Do you allow your admin team to start gathering that health history information? What is the protocol of the office? Do you want them to sit in a private area to review so that you'd have more information? The admin wants to help. We just don't know what you want us to help with. Do you have the appropriate entertainment? In other words, don't have bad dental movies on. That's really not going to go over well once they sit in your chair. How about magazines? You need to make sure you have appropriate reading material. And our doctor always picked the most appropriate reading material, men's health, women's health, but find something appropriate. Don't let them out there waiting. I mean, yes, they're going to have their phones to read, but make sure there's something that the doctor wants to guide in the direction that he wants to go or she wants to go. Now, the bait and switch. This was big in my day when I was a teenager. Bait and switch, free cheese, but what's the switch? You'll be trapped. So think about that. Patients are just cautious now. So treatment plans should include any and all possibilities. Like if they're in a surgery and there's a possibility of a block graft needing to be done, that should have already been explained. I used to write in parentheses possible, because I don't like surprises. I hope you don't like surprises either. Well, our patients don't like surprises either. So make sure that when you treatment plan, that you're treatment planning any and all possibilities. So like I used to say, eye, teeth, back, is there a sinus involvement? What is the percentage that a sinus elevation would need to be completed? And what we would do is we would put sinus elevation possible, because then all possibilities would have been discussed within our treatment conference. And then if you do cleanings the same day or you don't do them, I prefer not to do cleanings on the same day. Well, our practice did not like to do cleanings on the same day because it put the hygienist at trying to figure out fast what was the best way or what they needed. Do they need scaling and root planing? Do they need a quadrant? And it puts them on the spot. It's difficult. So we used to make a cleaning appointment and an exam appointment at the best time for the patient. Sometimes they were a week apart. Sometimes they were a couple of days apart. But every time we hung up with a new patient wanting to get into our hygiene department, there was always 2 appointments, a new patient exam with images and everything else, and the hygiene appointment, because then the hygienist could prepare. It's setting everybody up for success. Patients don't get mad when they understand the reason why, because we want to take the very best care for you, our patient. So we're going to schedule your exam appointment and prepare so we know what kind of cleaning is going to be the best one for you. And charging one fee to one patient and then a higher fee to another patient. Bad, bad, bad. That's pulling them in saying, oh, my friend down the road got a really good price, so I'm going to go see this practice. They get in there and say, oh, no, your fee is higher. That's bait and switch. That's getting them in by lowering fees and then charging them a higher fee. Wrong. Bad, bad practice. It's illegal too, by the way. Not sure if you knew that. Luring a patient in with a coupon. Number one, I hate couponing. Then charging them nickel and dime stuff. So, oh, we told you that it was for cleaning, but it was not anything below the gum line. So because we did this above the gum line and this below the gum line, we have to charge you extra. Or we said it was for bite wing x-rays, but we took 7 of them. So we had to charge you those 3 additional x-rays. I mean, if that's bait and switch, not a good practice. I would rather you put a coupon in a Valpak that has your doctor in a Superman cape and tights and saying, because I'm not Superman, I need to take x-rays to see what's going on under the gum line and into the bone. If I had x-ray vision, I wouldn't need to do this, but I don't. It made a difference for several practices that actually did that because it made their patients laugh and it helped them understand the necessity and the reason for the x-rays. So find a better way than a coupon. It's going to go a long way to your patients. Free second opinions. I hate this one, but it's so true. I found this coupon, and I'm sorry if it's your coupon, but I found it online. And what it's saying is, we'll do a second opinion, including the exam and x-rays, but you have to bring the treatment plan from the other doctor. If you keep your standards above board at all times, I wouldn't do this. Number one, our practice wouldn't do this. It's not right. I'm not going to, we're not trying to dissect another office's treatment plan. That's not what we should be about. There's enough dentistry to go around, people. There really is. If there are possible changes, make sure that you note them on your treatment plan. Again, like those possibilities that I talked about. If they are seeking a second opinion, it's because they don't trust the doctor. They don't have faith in the practice. And if they don't have faith in the practice, that's okay. But do you really want those people in the office trying to negotiate? Well, I went to this doctor and he lowered his treatment fee is this. How much better can you do? Is that what you really want for your practice? I hope not, because your practice is worth something. And I believe that if every practice would hold fast to that, they would go a long, long way. Don't hold this against patients, because if you're honest, they usually come back. And it's not to say, okay, how much will you give me off? It's to say, well, you were honest and told me that you would do this right away. And they kind of danced around that subject. So I'd rather stick with you. It comes back to your practice full fold. Now, treatment plans are based on diagnosis, severity of disease, as well as the desirable therapeutic end. What are you looking for? It's when we don't pay attention to what they're looking for that patients will end up leaving our practice, because a bad treatment plan contains things that are important to the doctor and not the patient. How about looking at the dollar rather than the health of the patient? Well, if I treatment plan this, it'll bring more money. If I do zirconium, it'll bring me more money because it's a higher fee. But is that the best for the patient? Is that what they're looking for or what you're looking for? Trying to fill your schedule. Hey, we can do it today if you'd like. Well, that's wrong. How about let them do what they always do. If they have a spouse, talk to their spouse, but always make sure they have an appointment. I used to schedule phone appointments with our patients. Why? Because I wanted to make sure they knew I was wanting to get their questions answered. Making something out of nothing. That's a big problem in dentistry today. How about finding a sweet spot to have the patient agree to unnecessary treatment? Oh, I've known your brother for so long. It's so good. You know, we really need to get all this treatment done. I know it's $10,000, but we can take out, you can put it on your credit card. It's not a big deal. No, that's just the wrong way to do business. Dentistry is business. It's your health care of your patients. Not explaining your treatment rationale, not showing them what could be the reason this is happening, and giving them some options of how to not let it happen again. Like your xerostomach patients that have a lot of caries. How about giving them some Biotine or some Saliva Max or Stella Life that helps them be able to not let it happen again, explaining to them that because of the dryness of your mouth and the acidity of your oral cavity, that's why you're having all these cavities. And I've got some products here and I'd like you to try them to see if it helps improve how your salivary glands are reacting, and that it could bring up that pH level. So again, what is that? Why is that important? Explaining to the patient your treatment rationale. Why do I need to have this? Well, because of this is what it's creating. Producing a fee for every item associated. Well, let's see, we have a fee for this injection and a fee for this injection. Let's see, we use Carbocaine on this one and Novocaine on this one. So that's $50 there and $25 here. I mean, there are some offices that are truly doing this and it's not right. So we need to just go back to what's right in dentistry. Making a condition seem worse than it really is. I love Dr. Gottlieb and how he talks to patients, and he'll say, if you were my sister, I would just hold off. Let's check it every 3 months and make sure that it's not progressing. But I don't think that I'd say that you need to get anything done on this right now. Or he might say, if you were my sister, I would tell you to move forward as soon as possible. I don't want it to get worse to where it can't be fixed. I love that about my doctors. How about hygiene hurts? I don't want to go to the dentist because the hygienist always hurts me. We hear it all the time. But how about we go backwards? Always talk about and reinforce your hygiene department. Lisa would certainly not be happy that you're disappointed. Now, I'm not going to throw Lisa under the bus, because I want to make sure that person knows that Lisa cares. Lisa would not be happy that you're disappointed. Or how about Lisa is my hygienist and I love how my teeth feel when she's done. Or on your next appointment, I think Heidi would be a better fit for you. So we're not throwing anybody under the bus. It's personality. It's not clinical, it's personality. So don't throw your hygienist under the bus. Find a way, maybe a softer touch is what they're looking for. Find that hygienist. Now, if you have only one hygienist in your office, talk to your hygienist and let them know what that patient, it's not every patient, it's that patient, what they need. And maybe that patient and the hygienist need to talk just so they can get on the same page. Cost. Everything is the dollar sign, as we heard on that video a little while ago. Oh my goodness. Could you believe that he wants his wife to go get a tooth extracted with no injections, excruciating, agonized, don't pull it out in sections, just rip it out. Really? He wouldn't do it for him, but he'd do it for his wife. Okay, no husbands ought to be doing that. Have you ever presented a treatment plan and you can see that look on your patient's face of fear and trepidation? I mean, but what if you could tell them there's a way that you could minimize these costs through their medical insurance? Well, we get it. What we do at DevDent, we get it. We come from dentistry into a medical world, and we see all the things that can be done through dentistry that can be billed to medical. That's why we're here. But if you could reduce or minimize these costs because of their condition, how much fear and trepidation would they have then? Because if you think about costs differently, we all know costs are high. It's high. I mean, look at the gas pumps, for heaven's sake. But it's all going to come full circle to dentistry. They're going to forego unless it hurts, they want to forego their dentistry because of the cost. But how about if we look at their health history and we look at the medical conditions that affect the oral cavity, like diabetes and that xerostomia that I spoke about earlier? Does the patient take medication that could cause the xerostomia? Well, it's a medication-induced xerostomia. Now, the medication is doing its job, but the effect is that the patient has a drier mouth, which creates more cavities. It's not that the medication, the doctor's giving them the medication just so that they'll have problems. It's doing its job. But the result is, number one, you need to show them things that they can do to treat that dry mouth. And then we need to fix it, and we're going to look at what medical benefits we can obtain on your behalf. And are you willing? There are people finding us on YouTube, calling us and saying, I'm looking for somebody to bill my medical. Do you know a dentist that would do that for me? Now think about that, people. They're not calling your practice, they're calling us. Well, we want that to be you. Those are patients looking for somebody that's doing things differently. Is that going to be you? The truth about medical deductibles. If you are only able to satisfy the deductible of your patient, you have provided a benefit. Don't think that you haven't done anything because you have no tangible check. That patient no longer has to meet that $3,000 deductible. You've met it. How about, did you choose the patient's deductible? No. But by law, you're required to meet the deductible before benefits can be paid. You are helping them by satisfying the deductible so that other things can be paid and processed. We're afraid before we even look at it. Boeing is a big insurance company. Well, their in-network deductible is $300 and their out-of-network deductible is $600. So we're afraid before we even start to look. So don't let fear control you when it comes to medical billing for dentistry. How about when a patient has had other care like pregnancy or have a baby or knee surgery, and I could go on and on. A lot of times they reach that deductible. So by the time you need to do treatment, they've already met that deductible. Very fascinating. Now, how medical billing sets you apart. Your patients are looking for a practice to think differently about their condition and their treatment. Is that going to be you? Fixing the oral cavity can help with the medical conditions like diabetes. It helps control their HbA1c or their blood sugars. It will increase case acceptance. Again, people are looking for any providers in dentistry that will be willing to bill their medical. Now, here's the catch. They're still willing to pay. They're just looking for somebody to help maximize any kind of benefit they could get. Look for new ways in these unprecedented times. This is something new that can actually benefit your practice. Many referrals are being made to our customers by word of mouth. Patients are telling other patients, don't go, you got to go see these guys. They bill your medical. And then patients finding us on YouTube, which I already spoke about earlier. Aggressive sales. Oh my word. Does your team not, or your team does not need your high treatment costs, right? They don't. High treatment costs are really literally that. So that high treatment estimates, they feel like you're doing these aggressive sales tactics, kind of like you're not selling a car, you're selling health. You're talking about how this is going to make things better, and it can be the longevity of it. That's important. Now, I mean, you need to make a difference in their life, not just, oh, we got to fill that cavity. Why do we need to fill that cavity? Well, a caries lesion is an infection on your tooth. And if we leave it there, it doesn't get better by itself. It actually can get worse and even worse in a very fast rate. And so we don't want you to lose that tooth. Make sure they understand what manifestations come about within the oral cavity. You know, there's a video out from Delta Dental, 120 diseases is what we can see in the oral cavity before it can be diagnosed by a medical doctor. That is fascinating and so factual. So believe it. Believe what we're doing is we are the doctors of the oral cavity. And when you do that, you start to make a difference in your patients' lives. And that is the most important thing above all. When you make a difference, you will always be the one they look for. One of our hygienists was able to find an amelioblastoma at 2 millimeters, 2 millimeters. She saw the tissue looked funny. She got the doctor. We did a CBCT. We sent him to the University of Washington right away. You know what? She made a difference. When the University of Washington told that patient what could have happened had he let it progress, he was so overwhelmed. He only lost enough bone for 1 implant to be placed in the mandible. That is so important. He will stay with that hygienist for life because she made a difference. When you're looking to make a difference, it changes everything. It's not aggressive sales. It's looking out for you and your health. So where does that leave us now? That leaves us with a story. So I want you to picture, if you will, one of our offices. Patient comes into the office and stops the billing manager. He said, I just want to thank you for billing my medical. And the office manager said, well, they only paid $37. And she said, the patient said, I know they only paid $37, but you were the first one willing to try for me. He was very grateful that someone was willing to try. I mean, think about that. Be willing to try, not promise. Don't promise. Don't say, medical's going to cover all of it. Don't do that. That's setting up for failure. But try. Do your best. Try. I have a story, it's kind of a funny story, that I have a patient that comes to find me in Costco all the time, like repeatedly all the time. And some might say he's a stalker, but he's not. He thanks me for billing his medical so that he could get the implants that he needed. Because he said, you know, had you not done that, we'd still be paying off that bill today. It's an amazing thing when you're able to help in the way that you do. So what is Imagine Billing? Imagine Billing is part of DevDent, and we are a software third-party service and support. We do online education as well as live education. But when it comes to medical billing for dentistry, you want to partner with the right company. It might not be us. It might be us. You know, we're not high pressure sales tactics here. Our job is to partner with dental offices and take some of that burden off of your plate. We would like to be known as your medical billing company for dentistry. Why? Because we don't want to take the place of your office. We want to be an enhancement to your office. We offer our expertise, our knowledge to our customers so that it helps you code, find the best avenue, find the best way, and whatever that looks like for your office. Because our billers know dental insurance, and we've crossed over onto the medical side. And that takes a lot of knowledge. We work to get practices over that we have practices all over the US as well as US territories, because we do get it. Our medical billing supervisor, Kim, all of our billers across the US, they understand what you're going through in dentistry, and we want to partner with you. Now, have upcoming courses, September 24th and 25th. These are live courses. And then in Charlotte, North Carolina, November 12th and 13th. You can look online and register at devdent.com. And I know we don't have questions because you're watching this, but if you need to reach out to support@devdent.com about anything that I've discussed today, we'd sure love to have you. We do have a Facebook group, Medical Billing for Dental Practices Imagine Billing. It is a private group. Nobody sells you anything. It's really billers trying to help billers and working together to come up with the best way to help your practice. So I hope that you'll stay tuned for our next webinar. And I thank you so much for joining this. If you have any questions, please reach out to 855-534-1433. Thanks so much. Have a great day.